Alalade here, and I'm talking tonight about polycystic ovarian syndrome, polycystic ovaries, and how it can affect or cause infertility. I'm hoping everybody can hear me loud and clear. If not, please let me check my audio here on Facebook. So I think we are good on Facebook, and also on Instagram we should be very good, and we're recording live for YouTube publication. It's been a while I've been on live. It's been busy, but despite the fact that we are still live in the background, ensuring things happen for you. So tonight I'll be talking about polycystic ovarian syndrome, polycystic ovaries, and the differences between the two of them and how they can cause infertility. So if you're free tonight, as always, one and only Dr. Alalade here by the grace of God, and I'll be talking about this topic today. So if you're free, listen to me and listen attentively. Like I always do, I love using my whiteboard here. And you can see the last time we had a discussion is a while ago. So let us clean this board. So listen attentively tonight as I'll be discussing. Always, the things we talk about on Facebook here on ATG is about women issues, and how things affecting women can cause infertility, can affect people's quality of life. We talk about ovarian cysts, we talk about thyroid problems, we talk about miscarriages, we talk about IVF, we talk about how your hormones can affect or cause infertility. We talk about heavy bleeding, we talk about fibroids, and this month of July is a wonderful month. We're just starting, and I pray that God Almighty will make this month a wonderful one for everybody, and that God will meet each and every one at the point of your needs. And I pray that God Almighty will give us the resources to do the things we need to do, each and one of us. Once again, I'm your host tonight, Dr. Alalade. If you're just joining us tonight live, welcome once again, and I'm happy to be here. And I'm sure that you're also thrilled, most importantly, to be in this program, and you're going to be a wonderful partaker of tonight's discussion. Like I said again, it's going to be about polycystic ovaries, polycystic ovarian syndrome. So the reason I've chosen this topic is that somebody came for a scan at our laboratory today, and they found that the person had a polycystic ovaries, and the person was confused. Obviously, it's a lady, because if someone has ovary, obviously the person is a lady now. So the person was asking what could be wrong. First of all, I want to say polycystic ovaries can happen on its own without causing infertility. I want to say polycystic ovarian syndrome can cause infertility, and in fact, they are entirely different. There's polycystic ovaries, there's polycystic ovarian syndrome. Again, there's polycystic ovaries and there's polycystic ovarian syndrome. They're very similar. So, but listen, polycystic ovaries is just used to describe something. So, for example, the fact that someone is an albino does not mean that they will have sunburn. But someone being an albino, they are very prone to having sunburn. That is to say, for you to have polycystic ovarian syndrome, you must have polycystic ovaries anyway. But you don't have to have polycystic ovarian syndrome because you have polycystic ovaries. What I'm trying to describe is that polycystic ovaries is just a descriptive term. Polycystic ovaries is just a term coined to describe the way the ovaries are. So if I scan you and I see your ovaries will look like this. Okay? And there will be a tube on this side, and that will be your womb here. Okay? That will be your womb here. Okay? And that's your cervix that opens into the vagina here. Okay? So that's your womb there. And that will be your ovaries. Obviously not as big as this, but your ovaries is attached. The ovaries will be attached to your womb by a ligament, what we call an ovarian ligament, like that. And that's through that ligament is where your blood supply to your ovaries goes through. And that will be the ovarian artery. The ovarian artery, blood flows there, heavy pumping directly from the abdominal aorta. The abdominal aorta gives us a branch artery that we call the ovarian artery. For the men, it's called testicular artery, and it goes straight away to the ovaries. The blood flow to the ovary is heavy. It's seriously powerful, heavy, because the ovary contains what we call totipotential cells that can develop into any structure, anything. The ovary contains storehouse of cells that can become anything in the human body: muscle, eyes, brain, anything. As far as they are triggered and switched on by the particular hormone to switch them on, they can become anything. They can tell any cell in the body to become anything. So the ovary is what we call a storehouse that contains 30 potential cells. That is why ovary can be prone to develop cancer, because the same thing to testes, because they contain cells that can become anything in the human body. So that's what your ovary looks like. If I slice the ovary of a person that has polycystic ovaries, okay, what I'll see inside is follicles arranged around, like a ring, around like that. If I see that in someone's ovary, definitely that person has a polycystic ovaries, okay? And that person is also at the risk of having irregular period, okay? They are also at the risk of having what we call irregular period, okay? So if you have many cysts like this on your ovaries, definitely it's called polycystic ovaries. So that is what PCO, okay? Polycystic ovaries, okay? When I put the S there, polycystic ovarian syndrome, that means that plus the fact that you have polycystic ovaries, you also have irregular period or irregular cycle. And also, when we do your blood test, okay, we see biochemical evidence that you have high level of testosterone and also high level of LH hormone, okay? LH hormone has a way, okay, of affecting your ovaries, okay? So if I do test for a lady that has polycystic ovarian syndrome, what we call their LH FSH, there's a ratio we call it, okay? I know this method is not old because nowadays it's not very reliable, but it's still very useful. If I do test for someone or hormonal profile and I see that the LH to over FSH ratio is more than 2:1, okay? Maybe the person does LH hormone and the LH hormone is about 15 and the FSH is about 3, okay? There's an obvious disparity. That is about 5:1. So once I see the LH FSH ratio more than 2:1, the person has polycystic ovaries, the person has a regular period, then or the person even has facial hair like that on my face, on their face, I call them and I tell them that you are likely to have polycystic ovarian syndrome. And in most cases too, their periods, they are irregular, or their period is very, very scanty, what we call oligomenorrhea. We put all this together. When all this happened together, we call them that this person, this lady, I'm sorry, you got what? You got polycystic ovarian syndrome. Polycystic ovarian syndrome is the #1 cause of infertility in the world, everywhere. When you have polycystic ovarian syndrome, you're prone to have irregular period, you're prone to have issues with infertility or even subfertility, and it makes getting pregnant difficult. Now, because a lady has PCOS, does not mean they can't get pregnant. It just means that the chances of getting pregnant becomes a bit difficult. Because a lady has PCOS does not mean they can't get pregnant. It just means that chances of getting pregnant become pretty difficult. So, but because you have polycystic ovaries does not mean you can't get pregnant. Because you have polycystic ovaries does not mean you have cancer. Because you have polycystic ovaries does not mean you're going to have a regular cycle, okay? For example, I saw this lady today. I was going through a scan. She has tiny cysts on her ovary. Definitely, it's polycystic ovaries. But the person's period are very regular, so that is good for them, okay? Now, what polycystic ovarian syndrome does is that you have very high LH hormone in the blood. That makes the ovaries become tiny follicles that don't ovulate. Imagine you have so many eggs in your kitchen or on your farm. Let's say you want the eggs to hatch and become chicken so you can sell more of them. But those eggs don't hatch because they don't contain embryo. They are like the eggs we eat in the kitchen, what we call anembryonic structures. So the eggs you eat in your kitchen every day to cook your cake, to do all sort of, or to eat your yam and egg, those ones are anembryonic. They don't hatch. But the eggs on the farm that hatch to become chicken, they contain embryo. The same thing too LH hormone does to the ovaries. They make these follicles on the ovaries contain no embryo, what we call anembryonic follicles, basically, in a nutshell. So these cysts on the ovaries, they don't contain eggs or follicles that can arch and become ovaries and become children. So basically, those cells will be like that. They go into tiny cysts and they are big like that, but they don't release egg, because every month you have such follicles, they release egg, they go into your tubes and meet sperm, big daddy, and they get pregnant. But in such cases, this person's follicles on the ovaries do not release eggs. They don't hatch. They don't ovulate. So people that got polycystic ovarian syndrome do not ovulate regularly, or because of that, they have irregular period or scanty period, what we call oligomenorrhea, or they have irregular period, and getting pregnant becomes difficult. You see ladies that they go for 2-3 months, no period, then suddenly on the 4th month, they have period, 6th month period, then 6, 7, 8 months, no period again, then they have period again. Your period is very scanty. You've gone for a scan, you're told that you have polycystic ovaries on your ovaries, and you've done your hormone profile. Maybe you got ILH in your system. My sister, you're likely to have what we call polycystic ovarian syndrome. Get treated. And what are the treatment options available for people that have got what polycystic ovarian syndrome? The first thing first is what? Weight loss. Like I said again, I was talking to this lady today. This lady, I know well, she's slim. She's not fat. So she's worried that, I'm sorry to use that word fat though. Doctor said I should lose weight, but I'm already lepashanding now. What am I going to lose? I said, what you need to do is not to lose much, but to regularly exercise. And when I say exercise, it's a very difficult thing, but it goes with discipline. By exercising at least 30 minutes each day, ensuring you're sweating, doing that for 3 days or 3 times a week, we're able to keep your body in shape. And in most cases, people with polycystic ovarian syndrome do ovulate with simple regime like that. If we do that already and it's not working, the next thing will be to consider surgery, where we go with tiny laser to destroy these follicles so that they get away and they can allow eggs that can be released, and they can allow follicles that can release egg to form. Okay, in some cases as well, polycystic ovarian syndrome has been known to be associated with type 2 diabetes in pregnancy or even before pregnancy. If you have polycystic ovarian syndrome and you're told that you got diabetes as well, what we can do is to treat the diabetes, and in most cases, we bring down the LH hormone and you're able to ovulate. But not everybody that has PCOS has diabetes, okay? But if you have PCOS, you got diabetes, the best thing will be to treat the diabetes as soon as possible with metformin, such a medication, and in most cases, they will ovulate. That's one of the treatment ways and ways to manage polycystic ovarian syndrome. I know people are watching and they got questions already, and so I'll switch on the comment section so I can start taking questions now. Okay, now let me bring my my camera a bit closer to myself so I can see questions being asked on our page. Now I can see moderators are already putting information up on the screen, so thank you. Thank you so much. Thank you so much to our moderators that already are putting information on the screen for people that have questions. So now let us take questions from people that have questions. Okay, I'm trying to locate questions on the screen. To you all watching us on Instagram, I say thank you so much. Welcome once again to ATG, Ask the Gynaecologist. I'm Dr. Alalade, one of your admins here at Ask the Gynaecologist, and it's a pleasure to be up here tonight, and I thank God for the opportunity to be here. If you know what it is, you see, to be alive, to be able to talk, to move, to do things you're supposed to do, it's not anything but grace. So I give God the glory for the time again to spend with you today. Time I spend with you, my family, our ATG people is always the best time. Thank you, Dr. Esther. Thank you, Deborah Semande or Chaba. And people are asking on Instagram. So on Instagram, I got a question here from a lady called Apetin. Is corpus luteum cyst normal in early pregnancy? Is very normal. Corpus luteum cyst is highly important in pregnancy. That is why it's important is that when you ovulate, okay, in pregnancy, assuming this is your ovary, okay, and you release egg from this follicle on your ovary, and that's the egg. That egg comes out, okay? Once that egg is out, this follicle that released that egg will now look something like this, okay? This remnant, okay, will become what we call the corpus luteal cyst. This corpus luteal cyst produces some progesterone, which are highly important and highly critical for the survival of the implanted egg or fertilized egg. So this egg now leaves the ovary, goes into the tube, okay, gets into the womb cavity, gets pregnant by the sperm that came from the ogasa. That fertilized egg needs to implant in the womb, which it does. But that fertilized egg needs progesterone to function, and that will be produced from the corpus luteum. That is why if a doctor sees a corpus luteum and thinks that is abnormal cyst and they go and take it out with operation, that pregnancy will miscarry. We don't remove corpus luteal cyst in pregnancy. No. It's important for it to be there so that it supports the pregnancy up until week 12. And after about week 12, 13, the pregnancy is okay and able to produce progesterone from placenta to sustain itself. And at that point, the corpus luteal cyst will regress and disappear. Okay? The corpus luteal cyst will regress and disappear. So it's important. Someone is asking a question on Instagram. What are the causes of spotting? There's two spotting. You can spot in pregnancy and you can spot outside pregnancy. If you're spotting in pregnancy, the number one thing is that you're probably having a miscarriage. In very rare situation, if you're spotting around your expected date of period, okay, that could be implantation bleeding. It's very, very light. But if you're spotting, you're bleeding in pregnancy, it's not normal. It's a risk of miscarriage. Get scanned. If you're spotting in between your normal period and you're not pregnant, that could be a sign of infection or sign of problem with your cervix. So get examined to check for infection and get examined to check that your cervix is normal and there's no disease on your cervix. Someone is asking, what drug can you recommend to treat someone that has high prolactin to take before IVF? If you have high prolactin, definitely we give medication like bromocriptine, bromegon, stuff like that. But it should be done and given to you while we monitor the prolactin consistently every 4 or every 5 weeks, so that we'll know if your prolactin is not responding, and if we know whether we need to increase your dose of medication. Okay? Right. 1 second. So it's very, very important, okay? I'm just cleaning something on this way. So it's very, very important, okay, that if you're taking medications to treat prolactin in pregnancy, you monitor your prolactin that is coming down. Someone is asking a question, Dr. Jide, on Facebook now, what supplements can, like ovofolic? Supplements don't help with PCOS. Supplements don't help with PCOS, okay? Please, doctor, I have PCOS. I went for IVF last month, but the doctor said my lining is not showing very well. What could... Oh, I can't see that question again. That question is gone. I can't see the question again. What causes scratchy throat and vomiting midnight? Maybe it's cough, maybe it's COVID. Get checked out. Doctor, can supplements like ovofolic acid help for PCOS? No, supplements don't work for PCOS. A question here on Instagram, what could cause me to menstruate twice in a month? It could be normal. If you have a 28-day cycle and your first bleeding is on January 1, you could bleed again in January 29, so you could bleed twice a month. But if you're bleeding consistently every month, twice every month, then it's important that you get examined to check for infection, check your cervix, that there's no bad cells in your cervix, or there's no polyp on your cervix, okay? Thank you, my sister Shalewa, for moderating here on Instagram. I can see Shalewa is moderating here. I came in late, or you are here. You were diagnosed with PCOS, but you menstruate monthly. You miss your menstruation, that means you ovulate every month. Very good. If you're ovulating every month and you have PCOS, you're likely not to have issues at all. Okay, so if you're ovulating every month, you're having period every month, you got PCO, no big deal. Can PCOS cause miscarriage? No. Once you get pregnant, PCOS is not a matter at all. PCOS does not cause miscarriage, okay? Good evening. What if scan says you have right ovarian cyst? Right ovarian cyst is different from polycystic ovary. So if you look at my diagram here, okay, follow me and follow me attentively, okay? Follow me and follow me attentively. So if this is your ovary, excuse me, oops. If this is your ovaries, right? Polycystic ovaries are cysts within your ovary. That's PCOS. Polycystic ovaries within your ovaries. But ovarian cyst, okay, is a cyst outside your ovary. Okay, ovarian cyst is a cyst outside your ovary. Ovarian cyst can twist on itself and cause pain. They can twist and cause pain, what we call ovarian torsion. Ovarian cyst can cause pain. Polycystic ovaries don't twist because they can't twist, they are inside the ovary and they can't cause pain, but they can cause infertility. That's PCO. But ovarian cysts can cause pain, but they rarely cause infertility. Okay, hope that makes sense. Can PCOS go away after delivery? Delivery has nothing to do with PCOS. PCOS can be there after delivery. So delivery does not do anything in any way to ovarian cysts. You were newly diagnosed with PCOS, you've been trying for baby, hardly see your period. Yes, so in that case, if you've been trying for baby for a long time, you've done your scan, they've told you that you probably have PCOS, that could be the reason why you're not able to get pregnant, and in such a case, you might need treatment for your PCOS. You might even need surgery for your PCOS as well, okay? Can someone with PCOS go for IVF? Yes, of course. In fact, PCOS is the number one reason why people go for IVF. And if you want to do IVF, our ATG IVF center is already open. We've now clocked a month now, and we are up and rolling. And if you want to do IVF in Lagos, the best place to go to is the ATG IVF center. We are already taking bookings for July. Don't waste time. Just go and get registered now, and let us look after you. And then I'll go through your results, and I'll work with our doctors there to ensure that you're getting the best treatment during your process. Why am I not ovulating 2 months after miscarriage? 2 months after miscarriage, sometimes it could be after a miscarriage, a delivery, your period could be slightly irregular, and afterwards it will settle down. So give your body time, see what happens in this 3rd month, and to see if you're ovulating or not. Thank you, Jenny Troyes, for joining on Instagram. I did an ovarian drilling in 2016, but PCOS is back. What can I do? Currently, your metformin and letrozole. If your PCOS is still causing you issue, at least the best thing will be to consider IVF as the last option. Okay. Good evening, doctor. That's Wanza Salina. Can progesterone tablet for 10 days monthly for 3 months help PCOS? Not really. Not really. No, it's got nothing to do. Progesterone tablets are usually given if you're not ovulating. Now, if your progesterone is very low. Now, if your PCOS is causing that issue, the progesterone tablet might help, but not directly related, really. Doctor, you don't likely... Oh, thank you so much, Dr. Esther, for answering that question. I saw a question answered now. Thank you very much. Okay, let us continue. Sorry if I've missed your question. It's just because the thing comes up so fast and it's difficult for me to follow after I've answered it. So I'm trying to answer one, another one comes in, I might not see it. So have patience, okay? I'm human being like yourself, and in fact, probably you even read faster than I do. I hope you can see the screen from on this angle on Facebook. Good. Okay, people can see from Facebook and on Insta ATG as well. Good. So let us continue our talk. Thank you, Dr. Esther. Doctor, what's the treatment for pelvic adhesions? So pelvic adhesions are scar tissue inside your tummy, in the lower part of your tummy. And what can cause pelvic adhesion? Maybe previous operation, previous appendix operation, maybe you have a current endometriosis. So what we do is that if there is we find it, we locate it, maybe we can suspect it on HSG, but in most cases through laparoscopy, we put a camera in your tummy, we see pelvic adhesions. The best way to do it is just to take it out straight away through surgery. Okay, you're going for IVF with PCOS. Which ones personal egg? You're going for IVF with polycystic ovarian syndrome. Deborah Chaba is asking that will they use your own egg? If your eggs are of good quality, they'll probably use it. Okay, doctor, I have 2 miscarriages in a row. That's Perpetua Onyechi. One in November last year and the other February this year. And all my tests came back fine. I haven't been able to conceive since then. Any advice? So if you're able to conceive naturally twice yourself, then it's not that you're not infertile or you're having issues with getting pregnant. The issue is that you need proper antenatal monitoring. So best is for you to get registered for antenatal care, where we check your blood group, genotype, check your rhesus factor. Very important. We need to check your hormonal profile. We need to check what your antiphospholipid, barrage of tests, okay? And we see if you can find or detect any possible reason for these miscarriages. And it's also important as well that if you had a miscarriage, if we're able to identify the pregnancy tissue, we do some tests on the pregnancy tissue to see if there's any obvious genetic problem causing these miscarriages. All right? Thank you, Dr. Esther. I can see your fingerprint there. Okay. What is the best treatment for polycystic ovarian syndrome? The best treatment for PCOS is to lose weight in most cases. Can PCOS cause heavy bleeding? No. PCOS does not cause heavy bleeding. PCOS will actually make your period scanty. PCOS will actually make your period scanty, not heavy. Okay? Doctor, what's the treatment for ovarian cyst? If you have ovarian cyst, if it's less than 3-4 centimeters, leave it alone. Scan again back in about 3 to 4 months' time. But if your ovarian cyst is more than 5 centimeters, scan again within 2 months. If it's getting bigger, take it out. Or if it's more than 4-5 centimeters in size, it's causing you pain, just take it out. There's no medication in the world that will shrink ovarian cysts. Contraceptives are able to prevent ovarian cysts from forming, but if you have ovarian cysts already, no medication will shrink ovarian cysts. I know people will ask me now, doctor, is there anything I can take that will shrink my ovarian cysts? No. Ovarian cysts must be taken out through surgery, or in some cases they will regress and disappear on their own. Fibroid and PCOS, what we won't do is God though. I don't know. It's God though. It's God though. There's nothing God cannot do. So just follow my instructions, okay? There's a question here. Amaka Nwodo. My cycle is irregular. I normally ovulate on day 14 or day 13. Last month it changed to day 32 days. How will I know when I ovulate? So if it's just changed for the first time, no big deal now. You've already said it, Amaka, that your periods are regular. So for the first time, it's changed its pattern. 32 days, fine. So see what happens next month first, because you don't treat everything, but see what happens next month. And if it's persistent that you're having a regular period, then we can start taking action. But for this, at this stage, if it's the first time your period is irregular, then just hold on. See what happens next month. Then we take it from there, okay? Just don't need to start panicking and start taking medications for nothing. Doctor, please, what is the best treatment for hypolactin? I already said it already at the beginning. And Gynae trace. Usually, if you have hypolactin will make you not to ovulate. And if you're not ovulating, you can't get pregnant naturally. So what we do is to give you treatment medication like bromocriptine, Bomegon, to bring your prolactin level down. While you're on such medications, you must be monitored with tests every 4 to 5 weeks. We check your prolactin level again, and we know whether we need to increase the dose of the medication or keep it steady. Okay, because some people take prolactin medication forever, for 2-3 years. It doesn't make sense. You might need to increase the dose if your prolactin is not coming down. That is why we need to monitor your prolactin while you're on treatment for these medications. Okay, what are the signs of hormonal imbalance? Many signs. When you say hormonal imbalance, which hormone? I'll presume you're talking about reproductive hormones like LH, FSH hormone. And if you're talking about these hormones, if they're imbalanced for a woman, especially reproductive hormones, LH, FSH, prolactin, testosterone, you're going to have irregular bleeding, and in most cases it will be scanty or light bleeding. So the number one cause of hormonal imbalance, or the number one sign of hormonal imbalance, is you don't get pregnant. Your periods are scanty. Okay. Margaret is asking, what causes polyps in the womb? We don't know. Nobody knows what exactly causes polyps in the womb. Polyps are these tiny fleshy skin tags in your womb cavity. Okay, sometimes they look like that. Sometimes they even so big that you can even see them hanging on your cervix. You can see polyps hanging outside your cervix like that. Polyps can be that bad. They can be that bad that they are hanging down from the cervix outside there. We don't know what causes polyps, but if we find it on scan, the best thing to do is to remove them with surgery. Okay, easily with surgery. What can one do to save a baby at 6 weeks after miscarrying at 6 weeks? So if you have a miscarriage at 6 weeks, you should be on aspirin in your next pregnancy. You should be on cyclodest in your next pregnancy to reduce the chances of miscarriage. What are the drugs to improve egg quality? Thank you for that question, Antonia and Neka. To improve egg quality, you can try and take medications that call this name DHEA. But these medications to improve quality of the egg are antioxidants. They don't increase the number of eggs. If you're taking this to increase your egg number, I didn't say so. you're doing it on your own volition. This will only improve the quality. Quality with L, quality. It does not increase quantity. What causes chemical pregnancy? Honestly, I don't know. There are many reasons, but nobody knows exactly what causes chemical pregnancy. Okay, doctor, what can make baby to stop growing in the womb? Maybe the blood flow through the umbilical cord to baby is not flowing well. Maybe the woman has high blood pressure. Maybe the woman has bad diabetes that's not well controlled. Maybe the woman has the baby has genetic problems and baby is not growing. Doctor, what is the difference between vaginal cyst and ovarian cyst? Vaginal cyst is cyst in your vagina. Ovarian cyst is cyst on your ovary. Ovarian cyst is cyst on your ovary. Vaginal cyst is cyst on your vagina. Okay? It's very rare to have cyst on vagina anyway. Somebody's asking a question. They don't see their egg white again. I always say this all the time, like gospel. You don't have to see your egg white to know you're ovulating. If you're not seeing your egg white, maybe you're not ovulating. I don't know. It's possible. But the first thing will be to do your hormonal profile. If you want to get it done, you can get it done at the ATG IVF Center. ATG IVF Center anyway. We have our laboratories there. We check your hormone profile to see exactly what is going on. But if you're not seeing your egg white, you don't have to see egg white to confirm the fact that you're ovulating or not. So seeing egg white is not a guarantee that you're ovulating or not, okay? Doctor, okay, let us see more questions here. Thank you, my sister Shalewa, for your text here on Instagram. Thank you all our moderators, Christina. Thank you everybody for all the information you're putting up on the screen here. Doctor, can PCOS be treated? Yes, it can. Okay. Doctor, good evening. What could be the cause of baby dying in the womb? Hormonal profile, genetic problems, implantation defect. We can have high blood pressure in pregnancy that is not treated. We can have diabetes in pregnancy not well managed. We can have thyroid problems in pregnancy not well managed. All this can cause stillbirth. Sometimes we don't know. Or sometimes it's even an infection, maybe a bacterial infection into the baby, and they can cause miscarriage, stillbirth. After doing HSG, can someone get pregnant? Yes. I've seen people get pregnant after doing HSG, but HSG is not designed to get you pregnant. HSG is designed to know what is causing your tube blockage. But I've seen people get pregnant shortly after HSG. Doctor, what causes hotness in the tummy? Because you're a human being. We are all warm-blooded animals, so we're going to have warm tummy. But sometimes some women, whenever they are ovulating, their tummy is very warm. Some women, when they are ovulating, their tummy could be a bit warm. That's normal. Thank you everyone for joining me here today. I wish I could be able to answer all the questions. Okay, but my talking span is usually 20-30 minutes. So I can't answer every question. Okay, if you want things done, you can, or want one-to-one discussion, you can always use our premium services, and all the services links are already been published up on the screen today by our moderators. So use the premium services, or you can get your test done at ATG IVF Center, ATG Laboratories. In fact, I always tell people all the time, if you do test at the ATG Center, ATG Laboratories, your result will be reviewed by me automatically, and my lab staff will give you a link to get in touch with me so I can go through your results. But you have to use our lab center for that. There's no free consultation. I can give you free consultation here on the screen as I talk, but if you want that one-to-one discussion, if you can use our laboratory for a test, just call Nike tomorrow, 9 to 2 p.m. She'll go through the tests you need, get them done, you forward them to me, and I will discuss the results with you through phone consultation. Or you can use the premium services. And also, if you want to get IVF done, you can get it done at our ATG IVF Center, opened already last month. God bless you. Thank you so much. Thank you, Dr. Esther. Thank you, Vivian. Thank you, Gloria. Thank you, Sister Amashalewa. And to all our other moderators out there, thank you so much. God be with you. I really appreciate you. Have a wonderful day. Have a wonderful weekend ahead as well. Thank you. Bye-bye.